name is Cynthia Miller. I'm currently a student at Oakland University. My study is the Master of Forensic Nursing, and I'd like to nominate my professor and the program director of the Forensic Nursing program. Her name is Kelly Berishaj, and I would like to nominate her for the ePIFanyNow Hometown Hero Award. She is passionate and she has so much to give and so much to offer the world of those that are hurting and the world of those of us that want to learn more about taking care of those patients in that.
It's very surreal to hear people talk about you in that way. I just think that we're all doing our part the best that we can. And I actually am very inspired by Cindy.
The forensic nursing program is one of a kind. There is no other forensic nursing program that we're aware of, right?
So we are the only program in Michigan. We just started our 6th year. We admitted our 6th group of students. The one benefit I really feel about our program is that we offer comprehensive forensic nursing, meaning that there's a lot of different subspecialties in forensic nursing in terms of being a sexual assault nurse, a death investigator, an emergency preparedness, legal consulting, and our program really offers education and training in all those different subspecialties.
I'm not sure I understand what the difference between a nurse and a forensic nurse is, and I don't know if you can simplify that at all.
Forensic nursing, the definition would be anytime healthcare and the legal system intersect. So the patient could be a victim, they could be a suspect, they could be a perpetrator. And the reason why we see them is they have a healthcare need. They're in need of healthcare services, but the reason why they're in need of healthcare services is because there's generally some trauma, violence, maltreatment. There's a legal aspect that's going to be a consideration in their care. And unfortunately, in today's healthcare provider education, whether you're a physician, a nurse, a physician assistant, a nurse practitioner, that's not routinely part of our curriculum, how to take care of a patient who has legal considerations in terms of the trauma-informed care that you need to have, how to correctly identify injury and document that, whether it be on a body diagram with photography, evidence collection, how to testify in a court of law. Strangely enough, is just not routinely part of healthcare provider curriculum. And so healthcare providers that want to provide quality care and services to these patient populations have to seek out additional education and training on top of whatever their degree may be. And because there's that legal consideration, the time that it takes to provide the care to a patient victim in terms of documenting injury, collecting evidence, and taking the time to work with the patient at the pace they would like to work, these types of medical forensic exams can take anywhere from 30 minutes, 2 hours, up to 4 to 6 hours. So a care provider in a traditional healthcare setting where they have other patients, oftentimes not only doesn't have education, but the time to dedicate to the patients. So
why were you so passionate about really starting this program?
I had been kind of searching for my place in the nursing world. I had been teaching for several years at Oakland University. I had my master's in education. I love teaching. And I was also an adult clinical nurse specialist, an advanced practice nurse. And I was trying to figure out how that could all fit together. And when I started digging into finding more about it, I found that sexual assault, while a very important piece, was about this much of a very large specialty called forensic nursing. I had really great colleagues that also expressed an interest to help begin figuring out how we could become a program. So I spent probably 3 years going around to our community, finding if clinical partners wanted to do this, if nurses would be interested, if our university and school supported it. And overwhelmingly, it was yes, 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 yes. This is what was missing. So it was kind of like the path just unfolded.
What kind of advice would you have for maybe somebody who's watching this and saying, I didn't even know that this was available.
Right.
What do I do? How do I get involved?
Yes. So For forensic nursing, in terms of a comprehensive forensic nursing education, I really recommend the academic degree. Most of us coming up had to piecemeal our education together, a conference here, a seminar there. Well, now we have these academic programs. So if comprehensive forensic nursing is what you're interested in, maybe we're really working to have a hospital role, the forensic nurse hospitalist, where it's a forensic nurse in the hospital. They see every patient, victim, suspect, perpetrator, whether it's a car accident, a stabbing, a gunshot wound, a sexual assault, human trafficking, child abuse. All these patients in level 1 and 2 trauma centers, they see this high volume. I would recommend getting at least 1 year of experience under your belt working as a nurse. So you have your foundational assessment skills and you start to learn that nursing role. We have students in our program that are from every single nursing specialty, pediatrics, OB, vascular, hospice. So you don't have to come from the emergency department or trauma. That's probably where you're going to see a higher volume of patient victimization, but we see it in women's health and in every type of unit. The 1 year of experience is the important part. And then I would start looking at programs and see what program fits your need. Our program is now considered online, which is a lot of the programs are, because we want to reach nurses across our country.
Is there a website that we could go to?
So there is our website at Oakland University, oakland.edu, School of Nursing, and we have a lot of different resources about forensic nursing up there. My email is my last name, Berishaj, BERISHAJ at oakland.edu, and I'm always willing to talk people's ear off about forensic nursing and answer any questions they may have. I think a lot of people hear forensic nursing and they think sexual assault and they think of scary legal things. What we teach and learn in forensic nursing, as I said before, are things that every healthcare provider needs to know. We learn it in our program as part of our specialty, but understanding mandatory reporting, understanding how to identify injury and document it, knowing how to talk to every person in a trauma-informed way. These are not unique to forensic nursing. Every healthcare provider should know this. So when people think of forensic nursing, it's going to improve your practice as a provider immediately.
Well, you're making a difference, Kelly, so thank you.
You're welcome. I appreciate you having me. I think I'm just one, set of hands in such a big movement. I appreciate being recognized, but I think all of my colleagues in forensic nursing, we have the best clinical partners ever, and I never would have been able to do it without the support of our school, our students, our clinical partners. So I appreciate that, but I'm one teeny tiny piece.
So Kelly, I always end every interview by asking everyone the same question, and that is, Kelly Berishaj, tell me something good.
I think that this is a really interesting time where nurses are going back to school to more fully actualize their potential and what they are doing in healthcare today. So I've been very inspired and surprised by that.
Well, Kelly, thank you for being an inspiration and thank you for what you do.
I appreciate it. Thank you for having me.